Good afternoon or good morning, everybody, depending on what part of the country that you're in. Thank you so much for joining us today. My name is Liam. I'm our Senior Account Manager here at Compliancy Group, and today we're going to be talking about HIPAA compliance and cybersecurity, doing our best to get really practical in terms of things that you can really start doing at your practice either today or tomorrow to just help you run more efficiently in a more compliant, secure way, and ultimately more profitably. It's what we believe it can ultimately do for you. I see that we have a bunch of people joining, so we're going to give everybody a second to just make sure that everybody can hop on, and then we'll get going here in just a quick second. All right, fantastic. Looks like we got everybody on here. Again, thank you so much for joining us today. We hope that this is educational, profitable, beneficial for you as we go through. Just as a quick introduction to kind of set the stage here a little bit, all of our webinars are recorded. So if you go to compliancygroup.com/webinar, you'll actually be able to get access to our webinar archive. So if you enjoyed the content today and you would like some more free education, we have a ton of different webinars on all different sorts of topics available on that website. I would highly recommend that you follow our blog, which can just be helpful in terms of keeping you up to date on some of the most recently updated requirements, current events, things that are going on. There's lots of white papers, infographics, HIPAA checklists, just lots of really good resources so that you can take what you learn here today and apply it even in an even more practical way. And as we go through here, keep in mind that GoToMeeting does have a question and answer feature. So typically at the end of these webinars, we'll have a little bit of time at the end where I'll go through and answer as many questions as I can with the time that we have for today. If we don't get to one of your questions within the time allotted, either me, myself, or somebody else on our team will follow up with you to make sure that that's addressed, and we're happy to help however we can. To quickly introduce you to us here at Compliancy Group, our business and our entire organization is built upon the idea of simplifying compliance for the small practice to more mid-sized organization so that you are more thoroughly equipped to focus on your business, knowing that HIPAA is handled. Okay, we are by and large a standard within healthcare. We're the endorsed solution of over 42 different medical associations and specialties. We are used by industry-leading managed service providers and IT firms, SaaS providers, hosting services, security consultants, insurance companies. We've been around for about 14 years. And historically, within the history of our company, we have well over 100,000 users on our platform. We have never, ever had a single client fail an audit. So I say all of that just purely for the sake of highlighting that, listen, we're not somebody here that just read a book on HIPAA. We've been around for a long time. We have a strong reputation, and we hope that we can take that knowledge and be able to pass it on to you. To talk a little bit around what we are trying to get at here with the content we'll be discussing today. Ultimately, we believe that the compliance and the security conversation, okay, in terms of understanding practically how you can do these things in your practice, is not only going to enable you, okay, to mitigate your risk, okay, in terms of preventing breaches and violations from happening, failed audits, all of that sort of stuff. We believe it'll actually fundamentally enable you to create better patient satisfaction within your individual businesses, ultimately leading to more profit. Because if we talk about HIPAA compliance, okay, and this is at a 100,000-foot overview, ultimately the annual requirements of HIPAA come down to annually assessing and then addressing your risks, okay? That's why that annual HIPAA risk assessment is so important, okay? It's really the baseline of HIPAA. We'll be talking about that more in just a little bit, but doing that annual assessment and then addressing any deficiencies that are found, okay? That is what HIPAA compliance is all about in terms of the overall annual requirement for an effective compliance program. If you are doing that and doing it well and properly, you'll be implementing the right types of policies and procedures into your practice that will actually lead to your staff operating more efficiently, more effectively, leading to happier employees because everybody's reading from the same playbook. Everybody's going to be trained, meaning better service for your patients, okay, because you'll have very much standardized your operations, meaning increased patient loyalty and ultimately more profit for the practice as a whole, okay? So one remarkable statistic that we were looking at recently is the fact that a practice that is HIPAA compliant and secure is on average 15% more profitable than one that is not. Okay, so the little bit of time and resources that you might have to dedicate towards this is remarkably valuable, not only for the sake of protecting you, but for the sake of enabling the practice to operate in a more proficient, effective, and profitable way. And all of this comes down, okay? The reason why this is so important is what we call this analogy of carrot versus stick, okay? When people hear about HIPAA, what they will typically picture is the government is this entity that has a big stick, and if you're going to get beat over the head with that stick if you are not in compliance. But really, it's the way that we want you to be understanding this is in a very different way, okay? And really understanding that you have a tremendous opportunity within your practice to position this for the sake of your patients, okay? Because who really controls your brand, okay? You might think that it's you if you are the owner of the practice. It might be your staff. You might even think that it comes down to the overall organization that you're a part of if you're an employee, okay? You might not have any say on it. Ultimately, the people that control your brand is your patients, okay? And so because of that, understanding what your patients think about you, understanding what your patients think about HIPAA becomes remarkably important because as we go through some of the statistics we'll be talking about today, you'll see we're highlighting how important this is and how you can actually use it to actually generate more revenue, okay? The importance of technology, okay? So we're having the conversation about cybersecurity, and just generally in the age that we're in, this has never been more important. Okay, so 62% of patients want to communicate with their providers by email. 64% would schedule online. 61% of patients would say that digital services are important when choosing a physician. Using online scheduling, this is a very interesting one, and improving online presence can bring in 20% more new patients. And one of the most interesting statistics of all of this to me is the fact that 2 out of 3 patients would legitimately switch their providers just for the sole purpose of having access to their medical records online. We live in a world that is built around technology, okay? And with technology comes things like social media, okay? Understanding the importance of things like patient reviews, okay? 72% of people are going to go online and check things like your Google reviews or your Yelp reviews or anything else as the first step in finding a new doctor. 19% after picking you will still go online to validate that choice. And out of all of the patients that you have right now, people that might have been with you for years and years and years, 9% of them will go online and evaluate you to see what other people are saying. Okay, if you can learn to leverage things like technology, like your online presence, it's going to help you not only acquire new patients, but it'll help you retain them because you'll be leveraging more of your positive reputation, okay, and putting that out there for the world to see. Because ultimately, what your patients are hearing about medical practices in the news is not going to be anything good. Okay, well, they're hearing all of the negative, all of the downside, all of the breaches that are happening, all of the violations that are occurring. Most recently, there was a dental practice, okay, that replied to a Yelp review and included patient information in that review, they were fined $10,000, okay? All of these different things, this is what your patients are hearing, okay? And if you are not able to leverage that appropriately, you are going to be falling behind. In a survey, when asked, are you confident your healthcare providers protect your medical records? 68% of people would say that they are not confident. And among people that experienced identity theft, 53% of those people would say that their provider directly caused or contributed to their identity theft. Okay, now imagine if within your practice you could figure out a way to get that number down from 68% that would say that you are not adequately protecting their records to 0. What would that do in the culture of your practice if your patients had that level of confidence and comfortability in you, and that level of trust? You'd probably keep them a lot longer. They would probably be much more satisfied. It would boost your reputation. They would tell more people about you. Because again, most people, okay, are not hearing any types of good things about the healthcare industry. Right now, 17,000 medical records are breached per day on average. 89% of healthcare organizations have experienced the breach just over the last 2 years. Okay, so if we've got 100 people on this webinar, right? Within the last 2 years or so, 89% of you would probably raise your hand. If this was an anonymous context, would probably raise your hand and say, yeah, we had a breach. Somebody clicked on an email that they were not supposed to, or somebody sent a fax that they were not supposed to, or somebody announced something in the waiting room that they were not supposed to, okay? 86% of all of those mistakes are administrative. People usually think of failing technology and things going wrong on that side of things, but the reality is that majority of these mistakes that are happening are as a result of your employees. And what you don't want to see somebody finding when they look up the name of your practice is the wall of shame. If you've never had the opportunity to Google this, there is a link there at the bottom of the screen. The OCR Wall of Shame is essentially a portal of all medical practices and entities that have had a breach of 500 or more patient records. Okay, it's entirely public record. Now, out of 16 practices that have a breach, okay, or that have some type of a violation that leads to an audit, out of 16 practices that get audited, only one of them will pass. Okay, and predominantly, it comes down to a failure to assess all of their risks, okay, like that annual HIPAA risk assessment, having a lack of administrative policies and procedures, or at least not enforcing those policies and procedures, or it might have been a vendor caused the breach and they did not have a BAA in place. Monetary penalties, settlements, all of these different things start coming into play. And what we want to talk about here is what ultimately is going to make your patients loyal to you. Okay, and even if we're talking about from a consumer perspective, okay, the way, and even if we're like online reviews, okay, and all of those statistics, people are approaching their healthcare more and more from a consumerist mentality. Okay, so even if we take brands like Starbucks, Disney, Nordstrom, what would be the 5 key predictors, okay, brand loyalty in those types of contexts? They would most of them would say overall satisfaction. Okay, so if it's Starbucks, that they enjoy their cup of coffee, right? That if they go to a different Starbucks location, that cup of coffee tastes exactly the same, that they receive the same level of service. What is your reputation like within the community that you're serving? Okay, that's why online reviews are so important to leverage, because more and more and more people are talking about this. Are they satisfied with how you are resolving problems? Okay, having problems that come up is not a big deal. People care less that there was a problem that occurred and much more with how you handled it after the fact. Okay, so what do you have in place to address that? Staff following through with what they say they will do. Staff treating patients with dignity and respect. Okay, all of these things, ultimately, what you'll find, okay, that all of these big brands are using to standardize their operation, building that type of brand loyalty, increasing the number of, they're boosting their reputation and getting people to come back, is actually nothing more, nothing less than what the government outlines as the 7 fundamental elements of an effective compliance program. Okay, so this document that you see here on the screen actually comes directly from the Department of Health and Human Services, and it is what they outline as their boilerplate requirement of HIPAA. Okay, so if we're taking that Starbucks example, okay, and the government published these guidelines from a compliance perspective, but let's take that Starbucks example a little bit further just to make some sense of this in terms of why it can impact the way that you operate as a practice. Okay, so implement written policies, procedures, and standards of conduct. Okay, so you have an organization like Starbucks. Okay, the reason why they are so successful is because I can fly to Los Angeles, okay, and order a cup of coffee or a latte or a frappuccino, and I can fly back to New York, go to an entirely different location, order that same exact cup of coffee. It is going to taste exactly the same. I will experience the same level of customer service. The environment that I'm walking into will be remarkably similar, and that is because Starbucks has in writing policies, procedures, and standards of conduct that everybody is expected to follow. They have designated a person at each of their locations to make sure that they are followed, which could be that office manager or front desk manager. Okay, they train their staff and educate them. They have built effective lines of communication. Okay, so what that means is essentially that what is decided upon by senior management gets very effectively trickled down to everybody else within that entire organization or company. They monitor that, they audit it. They have well publicized disciplinary guidelines for people that would break those standards, and they respond promptly when somebody is not abiding by them. Okay, this is exactly what an organization like Starbucks does, okay, to make their operation run more efficiently. What a lot of practices have, okay, so if we're talking about all of these different things, okay, that ultimately result in a really well-run operation, what most practices have is a store-bought HIPAA manual that sits in the back of somebody's office, collects an inch of dust over the course of time, and somebody might open it here and there. You might sign a document once per year, but it doesn't actually become a part of the culture within your practice. And that's extremely important, because otherwise you're doing something for the sake of checking it off of a box and not reaping any of the benefits that could come from it. And often the government does not recognize that anyway in the first place. Okay, so taking a step back from some of those broader ideas, okay, what actually is HIPAA? Let's just talk for a couple of minutes here and kind of break down what HIPAA is, what it requires, just to give some real roundabout clarity on all of this. If you take the 1,000+ pages of regulation and information that you can find online through Health and Human Services, okay, and the regulation itself, HIPAA boils down to 3 things, okay? It's the privacy rule, the security rule, and then the omnibus rule. We find that most people understand the concept of privacy. Okay, this is where your use and disclosure documentation comes in. It really directly relates to the way that you interact with your patients and when their information can be used and disclosed. The omnibus rule over here on the right, in a similar way, can get a little bit sticky. It's still somewhat straightforward, okay, in the sense that, first of all, it's breach notification, the breach notification rules, meaning that if there is a breach that occurs, that of course has to be reported to the government. If it's less than 500 patients, you have until the end of the calendar year. If it's more than 500 patients, that breach has to be reported within a 60-day period. All right. Also, if it's over 500 patients, you do have to notify the local news outlets, okay, so that they can notify the public about it, and each patient must be notified as well. Okay, so that's breach notification. Business associate agreements, again, some of this can get a little bit sticky. If you have some specific questions on this, feel free to ask in the question box and I can address it at the end. But essentially, the business associate agreements and the omnibus rule was implemented because if you are working with a vendor and that vendor has access to your patient's information, you are required to execute a business associate agreement that essentially states that you are responsible for your HIPAA compliance, your vendor is responsible for their HIPAA compliance, and you are each individually responsible for anything that might go wrong. Okay, coupled with that, and getting those agreements in place, it kind of creates a firewall between you and your vendors, just making sure that if that vendor has a breach, you are not liable. But that is paired with the fact that the government also does require that you're doing what's called a technical due diligence on your vendors, meaning that you should be vetting your vendor to make sure that they're trustworthy prior to sharing patient information with them. Okay, so that's a little bit of an overview of the omnibus rule. Now, the security rule is where we really see, especially the small practice getting stuck. Okay, because they interpret the security rule to be a predominantly technical component. Okay, so they think that they're working with an IT guy, they have a firewall in place, all of their antivirus systems are fully updated, they have, from a security perspective in their technology, everything that there needs to be. The interesting with the security rule, though, is that the assessment requirements of the security rule are not just technology. Okay, so if all that you're addressing is your annual security risk assessment, whether that be from MIPS or meaningful use, SMEC, or anything else, you are missing out on what is probably 2/3 of the remainder of the security rule, which has nothing to do with technology and everything to do with your physical practice, your administrative audits, your privacy audits, and implementing things of that nature. Okay, if all that you're addressing is the SRA, you are covering approximately 1/3 of one of the HIPAA rules, leaving all of the rest of this on the table. Okay, because what we find predominantly is oftentimes part of the trouble for HIPAA, okay, is that it has to apply to everybody in very, very broad strokes. So you have some of the largest regional hospital groups and insurance companies in the nation. You then have the smallest of single doctor practices. HIPAA applies to everybody in the same exact way. The requirements do not change at all whatsoever. What often happens is that that small practice, okay, will address bits and pieces of the regulation. They might be doing their SRA, they might have some policies and procedures and be doing those trainings, but they're missing those other administrative and privacy audits. They're not fully, because of that, they're then not fully identifying their gaps and remediating them, not implementing the proper policies and procedures and training. As part of that assessment is making sure that those are fully updated and reviewed. Training the staff, executing BAAs, coming up with an incident management plan. All of these things become extremely important. And again, to the government, they call it an effective compliance program because this is not a matter of checking things off of a box and saying that you did it. It's written intentionally vague because the government wants you to implement these in a way that is practically relevant and effective for you. Okay, and that's all things that we're here to help you do. And along the lines of security, right, like what we were saying before, things like antivirus, firewall. Ultimately, the types of gaps that you'll be identifying if you're doing that full assessment are much more in-depth and uncover a much broader scope of things that you need to be doing within your practice. And transitioning now over from HIPAA in general to get more specific around the security conversation, I want to talk about just the idea of security as a whole. Okay, because what people typically think of when they hear the word security is they think of the tools or the technology and the things that we deploy or use to accomplish it. So you have your firewalls, okay, you have your backup, encrypting your data, spam and virus protection, all of these different things. When you look at even just the definition of security, what it really comes down to is freedom from fear or anxiety, peace of mind. Okay, and this could be peace of mind for you as being the one who is operating this practice, ultimately responsible for the data that is being transacted in that practice, but also peace of mind and freedom from fear or anxiety for the sake of your patients. That's why this is such a powerful thing to consider and implement inside of your practices. And there has never been a time in the world when we were more at risk for these types of attacks, because you have general theft, okay, which is somewhat more common. You have things like hackers, okay, which again is actually not that common. What we find are the two #1 sources of attacks are phishing scams and ransomware. And to break some of this down a little bit, ransomware, and you'll see the book definition there, is malware that attempts to extort money from a computer user by infecting and taking control of the victim's machine, files, or documents. To kind of plain English that a little bit, it's, let's say that you get an email, okay, and you click on the link in that email, unsuspecting. You then get a pop-up, okay? That pop-up is saying you need to send $5,000 to this account number by this day, or I am going to wipe this entire machine of all of the patient data that is on it, okay? That's ransomware. It is when somebody gets into your network, they encrypt all of your data so that you no longer have access to it, and in order to get it again, you have to pay money, okay? Ransomware in the news, this is becoming a bigger and bigger and bigger thing, okay? And healthcare, believe it or not, is the #1 industry affected by it because it is the fastest growing sector of the US economy with the highest vulnerability to cyber risk, okay? Because predominantly, again, out of 16 practices that are audited for HIPAA purposes, 94% of them result in failure. Government enforcement has been up 400%. This totals to over 5 million small and mid-sized businesses and practices within the US, representing 26% of the total US economy. And of all of the people that ransomware are targeting, okay, 31% of all ransomware attacks are perpetrated against a small to mid-sized healthcare entity because they are the most vulnerable, and the information that they can get from you is actually the most valuable. Right? Somebody's PHI, okay, could be sold on the black market for 10 times more than a credit or debit card number. Okay, and that is specifically because where a credit or debit card number can be used for a quick transaction, okay, they might make a couple of bucks off of it. Something like a patient's personal information, diagnoses, all of these different things can be used from anything from identity theft to blackmail to any number of other things, okay? It has a huge amount of implications, which is why healthcare is so targeted. And the #1 reason for why most practices are having this issue, as outlined by CompTIA, is a mistaken belief that their current security is good enough, okay? And part of the issue we see here is that we are only looking at this from the technical side of things. But understand, 76% of the breaches that happen in healthcare are not as a result of a purely failing technology issue. It's things like lost devices, phishing attacks, meaning somebody clicks on an email that compromises your data, staff disabling security features, malware, or even if you have an IT company that you know and you trust, 26% of the time, it's actually the IT staff's failure to follow policies and procedures that were put in place. This is not a matter of failing technology. Most often, it is a matter of failing people, okay? Human error. And if you're not addressing the people component, okay, it doesn't matter how secure you are from a technical perspective, you could be like Fort Knox and still extremely, extremely vulnerable. It's the idea of a castle's walls, okay? If you're into things like Game of Thrones or things such as that, you have that idea of a secure city. There are walls around it, okay, that to protect from outside invaders. But ultimately, the greatest risk, and even at the data that you're seeing in this practice, in these statistics here, the greatest risk within your practice is not from an outside source trying to come and get in and steal your data. It is from your own internal staff not following protocol or not being properly trained to recognize an attack and prevent it from happening. Okay, and the real cost of all of this is much more, so there are HIPAA monetary penalties, there are fines that the government levies when there are violations. For things like ransomware, okay, out of people who actually paid those ransoms, 1 in 4 of them will never recover their data. Imagine what it would do to your practice if you lost your patient information and were never able to get it back. 63% of people that report a ransomware attack say that it led to business-threatening downtime. Actually, it was barely a month ago, you might have seen it in the news, there was a small practice where the doctors legitimately decided to just retire after having all of their data wiped as a result of a ransomware attack, okay? 48% of people report ransomware led to the loss of data and or hardware. Okay, so whether you get that data back or not, what would it do to your business if you were not able to function for a month, or even as little as 2 weeks, a week, a day? Okay, how much money would you be losing is what we're ultimately getting at here. And things like ransomware, malware, it ultimately comes, the biggest source, okay, you'll find of everything that you'll be looking at is emails, email attachments, links and emails, things like that, okay? Because all that it takes for me as a cyber predator is I go to your website, I copy down your domain, and I come up with a conjured email account, and I send you an email. I send everybody on your staff an email from owner at your name, the name of your practice.com. Okay. I include a link in that email and I say, hey, if you could very quickly just check this out and see if it's something that would be worthwhile for the practice, I would really appreciate it. One of your employees clicks that link, you now have ransomware. Okay. All of your data is encrypted and you're going to have to pay money in order to get it back. Okay. This is what is happening in the world today, and it's why it is so important that you be training your staff on how to recognize these things. Because if we're talking about human error, okay, your technology means very, very little. And even if you remember, so a couple of years ago, or it might not even have been that long ago, if you remember the Hawaii nuclear emergency that happened, where all of these alarms and these warnings were set off saying that there was a missile headed for the state of Hawaii. If you take a look at the director for the Hawaii Emergency Agency, and then look at his Instagram page, okay? What you'll find is on his Instagram, he posted a picture of himself standing in front of his workstation, clearly highlighting all of the technology and the tools that they have in place to prevent these types of risks from happening. Zoom in on that photo, and what you'll find is that he had the password for his workstation posted on a sticky note right on his monitor. Okay, do you think any of that technology matters if you have that type of negligence happening within your practices? Okay, and if we're talking about ways to prevent ransomware from happening, number one way in terms of protecting your business from ransomware is to implement backup and disaster recovery. We'll talk a little bit more about how to effectively back up your data in just a minute. Number two, what the experts say is employee training, okay? Training your staff. So even though we're talking about security, that specifically is a part of the compliance conversation, okay? 94% of what the experts say is the best way to prevent a ransomware attack from occurring, you would be doing anyway if you were HIPAA compliant. All of these things are requirements under HIPAA, okay? And understand, this is what we mean when we say that security does not equal compliance. Okay, so you have organizations like Cottage Health. There was a security configuration setting of the Windows OS that essentially permitted access to files containing PHI without requiring any type of a username or password. Okay, they had an IT company that they were working with, okay, that was supposed to be enabling them to ensure that they were entirely secure and compliant and all of those things. But one of their servers was misconfigured following that IT company's response to a troubleshooting ticket exposing that EPHI over the internet. Other things, it was an IT firm in Philadelphia, incomplete risk assessments, okay, failure to have policies and procedures. This IT firm lost a smart device containing patient information on it. They were ultimately fined for it, okay? Ultimately, and you'll see a quote here from Roger Severino, the director of the Office of Civil Rights. The Connors settlement reminds us that information security is a dynamic process, okay, meaning that this is not a quick hit type of a thing. When we talk about creating a culture of compliance, this is what we mean, okay? So let's get really practical here in terms of, we're gonna kind of create a little bit of analogy just in terms of the way that you would protect your house, okay? Let's take that idea and present that in a way that kind of highlights some things that you could be doing from a cybersecurity perspective, okay? So first of all, what do you do to prevent these things from happening in the first place? Well, if it If it was your home, you put a lock on your door, right? So that if somebody tries to break in, they are not able to. Within your practice, this is going to look like conducting that annual HIPAA risk assessment, identifying those types of gaps and deficiencies, implementing a firewall, training your staff so that they recognize an attack before it happens in the first place. We take this even a little bit further. Let's say that you have a lock on your door, but somebody breaks in anyway. They get through a window, they break the door down, they do whatever they have to do to get inside. You've got to have a way to know that that's happening. And in your house, usually this is going to look like turning on an alarm, right? Setting an alarm before you going on vacation, and you know you're going to be gone for a while, right? From a cybersecurity perspective, this could be like implementing a spam filter. Okay, actually having some sort of a monitoring software deployed on your network to make sure that these things are being detected. Virus protection, policies and procedures, so that everybody is on the same page and understands if there is a breach or violation that happens, they understand how to report it, how to inform you about it, what to do and how to handle it. And then recovery. Okay, so let's say somebody breaks in, it's detected, okay, but they wind up getting away with things like let's say that they take your TV, okay, or expensive jewelry, okay. You need a way to recover that. And so this is why in your house, you keep it bad at the door, right? So that if you find somebody that has gotten in, you want to be able to get them to put down the materials they were trying to stealing and get them to leave. From a cybersecurity perspective, this is going to look like things like encryption, okay? Making sure that your data is encrypted so they can't get access to it in the first place. Storage and backup and recovery plans, meaning that if all else fails, you need to be able to recover that data quickly and efficiently so it does not impact the way that you are operating as a business. And all of these different things, okay? So if we're talking about the HIPAA compliance, a lot of these things you'd be doing anyway if you were following the annual requirements for an effective compliance program. Because ultimately what HIPAA is going to come down to is assessing your risks. That is a one-time per year assessment addressing your security, your operations, your privacy requirements that will enable you to identify your gaps and remediate vulnerabilities. Training your staff, making sure that everybody knows what to look for and how to identify attacks. Policies and procedures, which will stop ransomware infections before it even happens, okay? Making sure that everybody is reading from the same playbook. Encrypting your data, backup. The 3-2-1 rule is what we'll talk about in just a second here. And that is that in order to have an effective backup or disaster recovery plan, all of the data that is in your practice, you should have 3 copies of it, okay? Of those 3 copies, 2 of them should be in different formats, and at least one of them should be offsite. Okay, so 3 copies of data. So you have what is on your workstations to begin with, okay? You then might have an external hard drive, okay, stored at your house. You then might also, in addition to that, have data stored in the cloud. Okay, a cloud backup is a great way to do this, and it covers that off-site thing, because that means that, let's say that a physical disaster occurs, that there's an office fire or some other type of natural disaster, hurricane, earthquake, depending on the part of the country that you're in, that might be more relevant. But essentially, having that cloud backup, or at least an off-site backup, as far away from your practice as possible will ensure that even in the worst case scenario, you are still able to recover and get back up to speed very quickly. So what can you do right now? All right, we're going to give you a couple of things that very practically you could take back to your practice and start doing these right away. First and foremost is becoming HIPAA compliant, okay? If you are familiar with the HIPAA rules, okay, and are not entirely certain where to begin in implementing this, please give me a call. I am more than happy to assist you and just giving you a little bit. This is going to be very individual based on your practice, okay? So I'd be happy to kind of break that down for you in terms of helping you understand exactly what this would look like for you individually and how you can make that happen. Update your passwords, okay? So nobody I hope to God that this is not the case, but nobody should have a password on any of their workstations that is password in all lowercase. Okay, you should be using either a combination of upper and lowercase letters, also numbers and symbols. What is currently outlined under the NIST guidelines as the most effective password is actually a sentence or phrase, okay? Because ultimately, the longer that your password is, the better, okay? And so if you can use something that is personally meaningful to you, a simple phrase, and mix in some numbers and special characters to make it a little bit more difficult to crack, that is an incredibly powerful password. Show your staff what to look for, okay? How to recognize a phishing attack, okay? What does ransomware look like? Figure out a prevention plan to keep it from happening in the first place. And there's something under HIPAA called the minimum necessary standard, okay? So in that assessment of your practice, find out if anybody in your practice has access to information that they don't actually need to have access to do their job. The minimum necessary standard under HIPAA very simply means that the people in your practice and the vendors that you are working with should only have access to the information that is absolutely essential for them to do their job. So just do a check on that and see if that's not the case, because that could be a big risk that you're facing in the event that somebody has access to information that they do not need to do their job, because that's ultimately a liability for more human error to be coming into play. Update your anti-malware and antivirus software. And by the way, this deck will be sent out to everybody. You'll have the recordings, all of this information. If you want to review it, will be readily available for you. You can reach out to me if you don't get it. But then the spam filters that show those hidden extensions, making sure that you can recognize those things. And then most importantly, if you want, in the worst case scenario, if you want to make sure that your practice is protected, even in the event of a ransomware attack or any other type of natural disaster, malware, phishing scam, whatever it is, come up with a backup plan and test it. Make sure that you, in the event that all of your data gets wiped, that you are able to very quickly and efficiently get back up to speed. Okay, take a screenshot of this, bring it back to your practices, start trying to implement some of these things, and you'll see actually the difference that it makes, okay? So especially from a training perspective and a policy and procedure perspective, just in the way that you run your practice, it's gonna make you more efficient, okay? Your patients will be happier, okay? Because your operation will be much more standardized. You'll be in a position then where you're not only protecting yourself, you're protecting your patients, and you'll ultimately be making more money, more profit as a result of that. So as a part of this, we do have a free security and compliance checklist that is available to everybody on this website. So feel free to click that link at the bottom here, or just that is a clickable link that you should be able to access. Okay, that'll bring you to our HIPAA checklist, which is a tremendous resource. You'll see my number and extension on there. Don't hesitate to reach out to me if you need anything. And then at this point in time, I'm just going to take a look at the questions real quick to see what we got here, and I'll do my best to address it. So just give me 1 second. So first question from Nicole, do you have a copy of the slides we can print? Yes, absolutely. So the deck will be sent, all of the slides from the slide deck will be sent out to you following the webinar if you need them. If you don't receive them, just please reach out. Please reach out to us. We'll make sure that you get it. Second question from Christine. How does a covered entity ensure business associates' breach assessment was proper or adequate, particularly when the business associates assessment seems conclusory or without factual support? Okay, so one thing to keep in mind when it comes to your business associates and your vendors, you are not responsible for anybody else's HIPAA compliance other than your own. What you are responsible for is to first execute that BAA, okay, and to conduct what's called a technical due diligence, okay, which the way that we would do it, would be by sending a questionnaire to that vendor, usually simple yes or no type questions, verifying their privacy and security processes, making sure that they're doing what they're supposed to be doing. As long as you have those two things on file, it does not matter if that vendor lied. It doesn't matter if they have a breach. It doesn't matter if they're actually not compliant. You did what you were supposed to as a practice to ensure that that vendor was where they were supposed to be. They answered yes to those questions. They signed a BAA. That means that whatever happens with that vendor, you are not liable. It is on them. Okay, so just keep that in mind. You can get a little, sometimes it's easy to lose the forest for the trees when it comes to issues like the BAAs, but just remember, ultimately, this is a matter of mitigating your risk. You are not responsible for anybody else. Another question from Gary. Why do computers allow external encryption? Shouldn't that be a verify that you want to encrypt before proceed? Well, in the event, so if I'm understanding your question correctly, in the event of something like a ransomware attack, usually just by clicking that link, the way it's very, very clever, okay? Because usually in clicking that link in the event of something like a phishing scam is actually, even if you have encryption in place, it is going to be ultimately allowing that cyber predator access to your network, because a lot of times even those links are disguised in a way that does verify and allow that entity to encrypt your data. Okay, so it's very, very clever. I may actually be misunderstanding this question, so feel free to shoot me an email if you need a little bit more clarity, and I can follow up with some of our cybersecurity folks to get a little bit more clarity on that. And again, copies of the presentation will be sent out following the webinar. So if anybody needs them and you don't get them, shoot me an email, reach out to me via phone or anybody else on our team, and we'll make sure that that happens. No other questions? So that is really all that we've got for today, folks. If you need anything, again, don't hesitate to reach out. We're happy to help however we can. If you're interested about learning a little bit more about Compliancy Group, again, our entire goal is to take all of these things and keep it very simple for you, walk you through a process to make it quick and easy. So with that, if you need anything, let me know. I'm happy to help. Have a good day.